What is up, y'all? This is Not a Real Doc DPT, and I'm not a real doctor, but I am a licensed and practicing doctor of physical therapy. And today we're going to be talking about the best way for you to help fix your back pain. This topic comes up for me today because I had a patient at church not a patient. I had a person that I met at church the other day, and they were talking about some pain that they had been having in their back, and they actually are having a surgery. And they were asking me about what things that they had researched and found out themselves, where when you actually have a spinal surgery of some kind, sometimes it can be in the neck, sometimes it can be in the low back or the thoracic spine, like right in the middle between your shoulders, and the potential for those types of surgeries to creep, where maybe you have a surgery on the vertebra at the L3, L4 area, and then that eventually leads to having a surgery at L5 and S1, then maybe up to L2, L3, and the problems that that can sometimes create. And yes, that sometimes is a factor when you have to do those more invasive treatments to help with back pain. But something that I wanted to impart to him, and that I talked to him about, not just about issues that were related to specifically what he was talking about, but to in general, just pain in general. Actually, the best way that you can fix or help yourself with some type of back pain, spine pain, neck pain, is to seek out the care of a physical therapist quickly and early. And that's what I was talking with him. And of course, I was not, making him feel bad or anything like that. But, you know, if we could see those things that you're having to have surgery for, oftentimes, if we as a physical therapist had been able to treat that patient, say, a year early, 2 years early, 5 years before that became the issue that it became, that where it requires surgery, we might could have helped to prevent that surgery. So the really the best thing that you can do when you're trying to treat your back pain is seek out the care of a doctor of physical therapy. Preferably, you're going to want one that is going to work with you doing manual therapy. Manual therapies can come in a broad category of things, whether it's going to be spinal manipulations where you're kind of popping joints, similar to how like you heard my knuckles pop just then. That's a manipulation, so you can do that at the spine, and that is associated with decreased pain. When that happens, then you have increased looseness to the joint, things move better, and then we can work and exercise and then help to strengthen those muscles and to stabilize in the future, so that you need that less. But there are other things like dry needling. There are myofascial techniques that you could do to the musculature around that area that can kind of help with pain that might be coming from the fascial layer and the musculature, with scar tissue buildup, etc., from inflammation that may be present. So there are a lot of different types of manual therapies that can be done to help with back pain. There are modalities that can be done. Modalities are generally used sparingly in good practices, I would say, but they still can be beneficial. You can still get traction. You can still, have TENS units. They, just basic ice and heat. All of that can help to decrease your pain and can help with that. And so then, after all that manual therapy is applied, then you're wanting to have a physical therapist that's going to be giving you the exercises that are necessary to help stabilize those joints, to help get your abdominal muscles to actually contract sooner. That's one of the things that research has shown, is that patients that are having a lot of back pain, oftentimes their deep abdominal muscles don't actually contract soon enough, or not strong enough to help stabilize the person's torso. So when you have your spine in the back and you have the muscles in the front, those are both stabilizing your torso. And so if the musculature is weak, then where does all the work get shifted to? That gets shifted to your spine. And so then you'll find a weak point in your spine, and there you go. So the point of video is just to try to impart something that you don't often see in these back pain videos. I've looked at a number of other videos that are online, and you're always looking at to physical therapists that are showing, like Bob and Brad, that are showing different exercises you can do, different, whether it's different positions you can sleep in, different ways you can work, things like that to try to adjust what is happening. But what's not often mentioned and really stressed and pushed is, hey, if you would actually get yourself in front of a doctor of physical therapy, you don't really need to follow all of that. And you might have better care. Not might, you will get better care when it's all more individualized to you and to your situation. So that is what I want to impart to you with this video. And also, let me come back to, not only is it important that you get in front of that doctor of physical therapy, but you also want to do that early. Get to it soon. If you start having pain that is not going away, and has been a few weeks to a couple of months, certainly 6 months, you're having this off and on pain in your back, then get yourself in front of a doctor of physical therapy that can help you with that. And oftentimes we can prevent a surgery. Oftentimes we can help you to fix and to get rid of, hopefully, that.